Hi, my name is Lauren, and I'm going to tell you why I think you should use the OPT model because it's going to be the best way to succeed at your performance. The OPT model, or Optimum Performance Training Model, is a fitness training system developed by NASM based on scientific evidence that progresses an individual through the 5 phases: stabilization endurance, strength endurance, hypertrophy, maximal strength, and power. The model should be used by coaches, clinicians, and athletic trainers to get athletes or patients at their peak performance while staying injury-free. My favorite reason is that the model is individualized, so it can be based on an athlete's specific sport while doing sport-specific exercises, or any patient while working at their own pace to satisfy their own needs. It doesn't matter your age, your body type, your fitness level. You are going to do the OPT model when you are going to be at your optimal performance level. I recommend setting goals and progressions for the specific athlete so it gives them something to work towards. They can use short-term goals and long-term goals. That way they can see their progressions and they can kind of feel accomplished and successful as they reach each goal. As long as the athlete follows the guidelines in order with stabilization, strength, and power, they will succeed. A disadvantage or a con of that would be skipping the phases or moving too quickly through them and not feeling comfortable with them before moving on. That's going to predispose the patient to an injury. It is important for the athlete to feel comfortable with first stabilization and then strength, followed by power. Another disadvantage would be not seeing the right outcomes or moving too slowly through the phases, but it's important to inform your athlete that they can work at their own speed as they feel comfortable. That's why I've learned that there is no cookbook approach to healing an injury. Everybody heals differently at different speeds, and that's going to be the same way with the OPT model. They can work at their own speed as they feel comfortable. That's why it's great that it can be individualized. Not every athlete competes or works the same. That's why it should be individualized. NASM has determined that each component in the OPT model is important. You have flexibility, core training, balance, SAQ, speed, agility, and quickness, plyometrics, and resistance training. A study from the Journal of Back and Musculoskeletal Rehabilitation in 2018 states that periodized functional resistance training decreased pain and disability, but improved balance and physical fitness in females with chronic low back pain. And chronic low back pain is pretty common, so as long as these components like balance and resistance training are decreasing the pain, that's going to help the chronic low back pain decrease. And another study by the Journal of Sports Sciences and Medicine found that components such as foam rolling or self-myofascial release, core exercises, and balance training are great advantages and strategies to improve range of motion, muscular endurance, and strength. According to NASM, the OPT model has been extremely successful in helping clients from diverse populations reduce body fat, increase lean muscle mass and strength, and also improve their overall health and performance. I personally think you should incorporate the OPT model for your patients and athletes because it is safe, challenging, and individualized. Each component will help you reach your optimal and most successful performance.